Welcome to another episode of You Can't Handle the Tooth. This is Dr. J, the real floss boss, coming at you with another episode. We're really excited. We love doing these Facebook Lives. Hasn't been as regular lately, which I do regret because I get lots of great feedback on them, but life just kind of gets in the way sometimes. But we're here today so that you can have good dental experiences and good knowledge to carry with you to your providers so that you can ask the right questions and get the oral health or beauty that you're looking for, all right? Today our topic is on dental hygiene, and I have brought one of our hygienists, Holly, who's going to answer some hygiene questions. So I know that most people watch these after it's live because it takes a lot of luck, right, to get people live all the time. So as you ask questions on here, and you can ask the questions after the video posts, we will follow up with the answers for sure. But if anybody wants to ask anything for your dental hygienist about anything that they do, why they do it, you know, what instruments they're using, please feel free to post those down below. But I have some of the more popular questions right now that I thought I would ask.
Wonderful.
Is there anything you want to say before we get started?
Go see your hygienist.
Yeah, go see him. Spoken like a true hygienist, right? Probably more often than you think you should. Yeah?
Probably.
Okay. So first, one of the big questions that I hear, because I hear people, patients talking when I'm not in there, and there's a couple of different ways that there's a couple of things that you do, right? Just generally speaking, what are like the things that you do?
For an appointment?
Yeah.
Generally, we update medical histories if it's needed. We talk about any questions or concerns they may have for me or the dentist. We take x-rays if they are due for any of them. We take measurements for gum health, overall gingival health, and then we do a cleaning.
So the cleaning, those like two components, two parts?
Yes.
Just
scaling part and a polishing part and flossing.
Yeah. Okay, so three parts.
Yeah.
Okay. So with regard to the polishing part, and patients, they probably don't know the difference. Maybe they do. Maybe I am not giving you enough dental IQ credit. But just so we can be very clear, in case they ever wonder, there's a polishing part and a scaling part. So let's talk about the polishing part. Is that like the middle?
It's the middle.
The middle?
Mm-hmm.
So in the polishing part, there are a couple of different ways that hygienists polish teeth. And in different offices, they call it polishing, but it may be totally different procedures.
Correct.
You want to talk about those?
Sure. So in our office, we have two procedures that we use. Most hygienists, they have two as well. We have the Prophy cup, which is what I would say that I do with 90% of my patients. It is literally a little Prophy cup with some paste, and we polish your teeth, rinse with water, and repeat the process. It's that wonderful grit that you feel in your mouth.
Bubblegum? Flavors, right?
We do have some flavors. Mint is the most popular because people have that freshness afterward.
That's a good one.
And then the second option is air polishing. And that is what our patients refer to as sandblasting if they've had it done previously. It is this very fine, almost salt consistency that is used on your teeth. And that's what we use for patients that have really heavy stain, like our smokers or something like that.
Yeah. Okay, so that gets in the little grooves. A lot of people think teeth are just like glassy smooth, and they are smooth, but when you look really close, they're actually pitted and there's little fissures in them. Really catches stain. And for the tough stain, we do this little sandblasting. I call it sandblasting, but I think they know what you mean. So the sand goes everywhere. You may have known that. That's when you really need the safety glasses, probably, right?
I use a mask over my patient's face, but yes.
You put it over their eyes?
Yeah.
No.
Yes, I sure do.
So they can't see you?
Well, yes.
We're going to switch to some safety glasses. All right, so anyway, I'm just kidding with you. All right, okay, so that's the polishing part. What about the thing that sometimes gets those sensitive areas and splashes a lot of water? What's the difference between that and scaling without using the water?
Okay, so both of them, if you have areas of recession or anything like that, will make you sensitive. The Cavitron is what you're referring to, and that is similar to our hand scale, except for that it uses water and it uses as a vibration motion as well. So it kind of flushes out that bacteria below the gums better than our hand scaling would. So we use that a lot of time if patients haven't been in a really long time, or they have a lot of hardened tartar calculus below the gum line, or a lot of plaque.
It gets it out.
It gets it out really well.
Like that. No?
Yeah.
Yeah. Okay.
It's not a good vision for your mouth.
Well, it chips it away. Okay, or you hand scale, right? Before they had ultrasonic, you had to hand scale. So that's when you see the instruments that look really scary, right?
Right.
Pokey, blades, sharp.
Yes.
And you hand scale it off, and then you get. Does it help you to use the ultrasonic versus the hand scaling? I imagine.
Yeah, absolutely. When I hand scale, you have to use a lot more wrist motion, and my thumb ends up, because of the grasp I have to have on it, to get those really hard pieces off. The Cavitron is awesome.
So some people may not know this, but the Cavitron, or that's a name brand of an ultrasonic type of instrumentation, they would rather hand scale than do that stuff, because maybe it makes their teeth a little more sensitive. But I remember reading that if you use the Cavitron, the ultrasonic, that you'll actually get deeper in the pockets, and you'll clean more than you would hand scaling. Like, it's not which one would you like, it's this one is better, so that's what you do.
So with the ultrasonic, a lot of times people don't necessarily get the feeling as clean, even though they may potentially be cleaner, because it does take a little less time than hand scaling does, and people don't feel like that. And then you don't have to apply as much pressure, and you don't feel that scraping necessarily, because you're feeling the motion. Exactly. So a lot of times people think that with the Cavitron, the ultrasonic, that they're not becoming as clean as they would be if you're using the hand scaling and scraping those teeth off.
Do you do both on most patients, or mostly just one?
It varies on every single patient. Every patient differs.
So it depends every time. All right, and then we've done probing before, but if you ever start saying, "Hey, I'm just gonna probe your gums," they're probably like, "Why?"
So I never say that. I say I'm going to take some measurements of your gums, and basically I tell them that I'll be moving around the gum line, and they may feel a little discomfort. It shouldn't be painful or anything like that, and that's to measure your overall gingival health, your gum health. And I tell them what numbers we like and why we like those numbers and what those numbers mean. Okay,
so these are all good stuff. Next time you're at your hygienist, right, you'll know what they're talking about when they say we're going to measure your gums. You'll know exactly what they mean. All right, just a couple of other things. Sometimes patients don't know this, but in most cases, I would hope anyway, there's a cancer screening that's done. Is that
yes.
Do most hygienists do that, or is it office to office?
Yes. No, every hygienist should be doing that. It's something that is sometimes so quick that it's unbeknown to the patient.
Yeah.
We look on each side of your tongue, below your tongue, your gums, palate, everything like that, just to make sure that we're not seeing anything that's abnormal.
So you wonder why they're going, just looking around. They may not say they're doing oral cancer screening,
correct,
but they should be doing it. All right. Just two other questions. First is, I hear them say a lot of times, hey, when you're looking at the dental chart, which has the teeth little cartoon things on there, they'll say, what's the red mean, or what's the blue mean, or whatever. Do you get that question a lot?
All the time, because in our office, we have the chart in front of the patient so they can see it as we're doing the cleaning and everything like that, and they say, what is all the red? And I say, well, the red is treatment that we've talked about before, and I'll review that again with you at the end of the appointment. The blue is stuff that we have already completed in our office, and then the green or gray, depending on which screen you're looking at, is stuff that you have completed, but it was at a different office before you came to us.
So we can tell if it's existing treatment that we did, or another dentist did it, before the patient came
Absolutely.
here. I do know this. I'm not sure. I just can't remember. It's been so long. When I was in dental school, you had to use a colored pencil and stuff for red. Now everything's on the computer, and the computer programs let you pick any color. So we could put it as blue for treatment plan and green for to be done and stuff. Legally, there may be you may have to put red as the treatment planning colors, but the software lets you put any color. So it may be different in other offices, but standard, pretty much red is treatment plan. All right, and then the last one, everybody wants to know about intervals. How often? We've done videos before on hygiene, but they do always want to know, why is it 6 months? Seems like it's so standard for everyone, when care seems like it could be a little more customized. Do you want to talk about that?
So with my patients, I typically schedule them for 6-month recares, and that I factor in their oral health. If they have a problem or something, I obviously want to see them beforehand. If my patients they come every 6 months to me and everything, there's a reason why, and that typically has to do with insurance. Insurance likes to cover, we have some now that will do 2 in a calendar year, which is wonderful because if they're a couple of days before or a couple of days after for vacation purposes or something like that, then insurance will accept it. However, most insurances still these days are saying once every 6 months, and they kind of mean every 6 months and 2 days. So I usually schedule my patients every 6 months and 2 days.
Yeah. Even though they could need it more often,
Absolutely.
Insurance a lot of times will drive that.
And I have several patients that will come every 3 to 4 months to get their teeth cleaned just because they know how important that it is, and they are willing to pay out of pocket for that.
I read somewhere a long time ago, and I haven't read it recently, but that the ADA actually recommends more than twice a year. So it's an interesting question, right? Just to ask your hygienist. If money wasn't in the picture or insurance wasn't in the picture, how often would you recommend that I get a cleaning? And there's other times too, right? Like if you're pregnant, maybe you'd want to get one more often. Throw an extra cleaning in there because it's really important to keep your gums healthy. Okay, well.
Don't be afraid to ask your hygienist any of those questions either.
Talk.
Because we love to get to know you, and we love to get to know our patients and their home and everything like that. But we also like to talk to you about dental stuff. So if you have any questions about what we're doing or why we're doing it, ask.
Yeah, and we try to take lots of pictures and stuff like that.
We do.
And most dentists now have intraoral camera. So they should take pictures and be able to show you, I hate going to the dentist. I hate going to like a mechanic and you don't know what they're talking about. They come out and tell you what's going on in your car and you don't know. But if they had a camera and could show you the hose that was frayed, or this is not a good analogy, but at least in dentistry, in most offices, you can say, do you mind showing me a picture of that? And they have a camera right there chair side. They can take a nice high definition picture of it, show you the condition so that you're kind of feeling, okay, yeah, I get it. All right, well, listen, we want to thank you for joining us for another episode of do you ever see A Few Good Men? Tom Cruise, Jack Nicholson?
Nope.
All right, well, he says it like this. You can't handle the truth. So you need to say it like that one time. You can't handle the truth. The tooth. You can't handle the tooth.
You can't handle the tooth.
So thanks for joining us for You Can't Handle the Tooth. This is Dr. J, the Real Floss Boss. Hope to see you back next week. Keep the questions coming. Really appreciate it, all right? Y'all take care.